Thank you for joining us for this Thursday's COVID-19 press briefing. The mayor today will provide an update on where we stand with vaccinations and testing, and especially as it relates to coronavirus cases community-wide. The Emergency Rental Assistance Program is moving right along. The mayor will discuss that program with you, and the mayor will discuss a few other items of note as well. Alvina Chu, epidemiologist with the Florida Department of Health in Orange County, is here and will report on important COVID-19 trending data here in Orange County. We will begin with the mayor.
Right. Thank you, Dr. Williamson. Thank you to all of you for being here. I feel pretty good about where we are with our efforts to contain the virus here within Orange County. So today we'll be sharing some news with you. I think that is very encouraging as we move forward. I hope to get to the point soon where we are no longer under a state of emergency, and I believe that that is going to happen within the next week or so. This is our 163rd news conference in response to the pandemic. As you all know, we've all been impacted now for 18 plus months. I'd like to start off today also by recognizing our Orange County Health Services team for the incredible way they have come together in leading the massive effort to keep our residents safe and healthy. As you all know, we began the process of working with the state of Florida, and the state had resources, staff that was here assisting with our response efforts. After a period of time, the state's resources were no longer in place, and so our Orange County employees and staff really had to step up to the plate and help fill that void. And so I want to recognize our staff. Since April 2020, when the county officially began COVID testing, the Orange County Health Services team, those are Orange County employees, have administered more than 460,000 COVID tests. In December of 2020, when the vaccines became available, the team immediately switched gears while still running the testing sites and established a vaccination process. To date, the Orange County team has administered more than 1.7 million doses of the vaccine to residents, helping vaccinate 74% of residents with one or more doses. Our amazing County Health Services Department are truly some of our unsung heroes here within our community as we have fought against the virus. Dr. Yolanda Martinez is here, and Dr. Martinez, if you just stand for a moment as we recognize your team, please give them a hearty thank you from all of us and all of us who live here within Orange County. We could not have done the job that we've done at this point without that team, and I will tell you they have done so without complaint. They have stood in the rain, they have stood in the cold, they have stood in the heat, they have smelled the exhaust fumes from automobiles, and they do it with a smile on their faces every day. So now let me just tell you a little bit about the numbers that we have. There are now 230,300 coronavirus cases reported in Orange County. The number of Orange County residents who have died from COVID-19, sadly again, the numbers have continued to go up. We have 2,126 that's reported pursuant to the records of the Florida Department of Health. That is 36 fatalities since we last met this past Monday. Our hearts and prayers do go out to all of those families, because every one of those numbers means that that is someone's loved one. On the positive side, we are continuing to see a downward trend in the 14-day positivity rate, which today is at 5.37%. Ms. Alvina Chu from the Orange County Department of Health will talk more about the ensuing decline of the positivity rate within our county. According to yesterday's numbers, only 209 new cases were reported. I never thought I would use that descriptor, only 209 new cases, but that's 209 individuals who tested positive yesterday. Free vaccines are still readily available at our health services run sites 7 days a week. Barnett Park is open between the hours of 9 a.m. and 5 p.m. Eligible residents may receive the Pfizer first and second doses, and as well as the Pfizer booster shots. The Moderna, the second doses only, and Johnson & Johnson, the first dose is available. And you all probably saw the news a little earlier today that Moderna has been approved for the booster dose by the Food and Drug Administration. There are particular categories of individuals who are eligible. The FDA Advisory Committee agreed the use of a booster dose would be safe and effective in some people 6 months out from their primary series. This would only apply to certain groups: people aged 65 and older, people ages 18 to 64 who are at high risk of severe COVID-19, and people ages 18 to 64 whose exposure to the coronavirus in their settings or jobs put them at risk for COVID-19 complications or severe illness. Free vaccines are still readily available at our healthcare services run sites. Again, Barnett Park is open between the hours of 9 a.m. and 5 p.m. Currently, the percentage of residents ages 12 and older with one or more doses remains at 74%. For more information on our testing sites, etc., you can go to ocfl.net/vaccines to get information on the vaccine sites. The I Got My Shot vaccine trailer will continue to be out this weekend. Tomorrow it will be at the Goodwill in Lake Nona between the hours of 11 a.m. and 1 p.m. and then in the afternoon at the Misty Oaks apartment complex in the Pine Hills area between the hours of 3 p.m. to 5:30 p.m. And on Saturday, it will be at the Iglesia Jesus de Nazaret. Dr. Martinez, I probably messed that up, but also on Saturday, the vaccines will be available at the Orlando Science Center between the hours of 10 a.m. to 5 p.m. Those getting vaccinated there on Saturday will receive a complimentary ticket for their next visit to the Science Center. You can find more information about that particular vaccine effort by going to ocfl.net/IGotMyShot. And to finish up the part about testing, the Econ Soccer Complex is open between the hours of 9 a.m. and 4 p.m. for COVID testing only. You can get information from the ocfl.net/testing. To date, nearly 2,000 families have qualified for help with their rent and have avoided eviction. More than $11 million have been approved for distribution to those families. If you need information about rental assistance, you can go to our website at ocfl.net/rental assistance. And now I'll give you an update about our redistricting efforts. The Advisory Committee for Redistricting will be meeting in District 4 this coming Monday evening at 6:30 p.m. They will be meeting at the South Econ Recreation Center, located off of South Econolathatchee Trail. You can get information about our redistricting from ocfl.net/redistricting. And just as a reminder, on Saturday of this week, we will be holding our virtual Orange County Community Conference, and it will be covered on Orange TV between the hours of 10 a.m. to 1 p.m. This is a dynamic event that provides residents opportunities to learn the latest information to help improve their neighborhoods. I'll be hosting a live chat with the residents during the event to talk about the future of our county. And finally, let me just share with you some news about some employment opportunities with the county. I'd like to share that the upcoming job fair will take place next Thursday, October 21st. Our Orange County Public Works Division is seeking to immediately hire equipment operators, masonry workers, and highway utility repair workers. The job fair will take place at the Apopka Maintenance Unit on Claricona Road next Thursday between the hours of 8 a.m. and 3 p.m. You can also apply online at ocfl.net/careers. And now we'll go to Ms. Alvina Chu with the Division of Infectious Diseases at the Department of Health in Orange County. And Ms. Chu, you're recognized.
Thank you. Thank you, Mayor Demings. As the mayor had mentioned previously, we've had a total of 230,300 total positive cases in Orange County residents identified since the beginning of this pandemic. Our 14-day rolling percent positivity average is at 5.37%. This is our third consecutive day where this average has been at or near 5%. And so we are encouraged that this will continue to decline as with the rate of new cases. Since on September 16th, just for comparison, our percent positivity average was 12.32%, and on September 27th, it was 9.07%. Unfortunately, we've had 36 additional COVID-19 related deaths reported to us since October 11th, the last time we met, and we want to extend our sincere condolences to the friends and families of those who have lost loved ones. Of those, 17 were female, 19 were male, 3 were Asian, 1 was a native Hawaiian or Pacific Islander, 2 were black, 29 were white, and 1 was identified as other. 12 were Hispanic, and 24 were non-Hispanic. 20 had known underlying health conditions, and 16 had unknown underlying health conditions. 1 date of death was from August. That was recently under state review and certified. 32 dates of death are from September, and 3 dates of death are from October. Currently, August 2021 remains our most deadly month for deaths during this pandemic. 5 of the 36 deaths were reported with a long-term care facility address. 8 of the 36 were fully vaccinated for COVID-19. The median age of these recent deaths was 78.5 years. The median time between series completion and positive lab result was about 180 days, or approximately 6 months. 2 of the 36 were partially vaccinated for COVID-19. 1 was past due for their second dose, and 1 was not past due for their second dose. As we had mentioned, I think the mayor had mentioned and Dr. Pino had mentioned earlier this week, we are currently have been moved to a lower category for community transmission. So we are currently classified as orange, which means that we are below the 100 cases. So the 7-day incidence rate is below 100 per 100,000 population. And also, currently our percent positivity, which is at 5%, also helps indicate that we are at the substantial transmission range. Delta variant remains the predominant strain that is circulating around the United States, and that is reflected here in Florida and in Orange County. I did want to note, as well as Orange County being in the orange category, the state of Florida has recently been categorized as having a substantial level of community transmission. So encouragingly, the entire state, as well as us, have dropped down a category. And as the mayor had mentioned, of those Orange County residents who are eligible to receive the vaccine, 74% have received at least 1 dose. Dr. Pino had brought this up on Monday as well. Just to mention, so flu season has started. So it is traditionally counted starting week 40 of the calendar year. So week 40 was October 3rd. And so we wanted to remind everyone to get their flu shots this year. And it's especially recommended for everyone who is 6 months and older, and including pregnant women. Please check with your healthcare provider or your local pharmacy to get your flu shot. And please, your flu vaccination, even if you're healthy, prevents illness in our most vulnerable populations. And so the message that we have for COVID vaccinations and also for flu vaccinations is to protect those who are around us and those who possibly can't get vaccinated, and to reduce transmission of these respiratory viruses in our community is to increase the immunity, which includes vaccination. So the same pandemic precautions that we have observed works against COVID and works against the flu. And so we'd like to remind everyone to continue to please stay at home if you're sick to prevent spreading any virus, respiratory virus, COVID or flu. Cover your coughs and sneezes and wash your hands frequently and thoroughly. I don't know if you've noticed, but I'm wearing pink today. And so at DOH Orange, we are promoting Breast Cancer Awareness Month, this month of October. And so you could check out our Twitter handle for some photos of our employees, hoping to get the awareness out there. It's Twitter. Our Twitter handle is @DOH Orange. And the Florida Department of Health in Orange County encourages all women to receive regular screenings to promote early detection and treatment of breast cancer. Our breast and cervical cancer early detection program provides access to breast and cervical cancer screenings that doctors recommend, and these screenings are free or low cost for those who meet the program eligibility requirements. And so this is a service that DOH Orange provides. To see if one qualifies, you could call us at 407-858-1421. And with that, I'll take any questions you might have and return it to Mayor Demings. Thank you.
All right. I just want to remind you that we do have Commissioner Myra Uribe that has joined us today. She often joins us for these press briefings. We have Commissioner Gomez Cordero also, who has joined us in the back. And we have our Director of Public Safety, Danny Banks, who's joined us, our HR Director, Ricardo Day. We have Dr. Yolanda Martinez from Orange County Health Services, who's here. And we have Mr. Scott Howard from the Orange County Public Schools. So should you have any questions for any of those related individuals, we will ask them to come forward. So there is a microphone that will be moving around. We ask that you wait until the mic gets to you before you ask your question, and we'll begin with the Q&A at this time.
Mayor Demings, Asher Wildman, Channel 13. As far as the Department of Health investigation with the list of people that was announced last week, have you been told how this investigation will work? Have you been informed you're being investigated, and just your reactions to this?
We have not been informed that we are being investigated, and we have not received any correspondence to such.
Steve Hudak from the Orlando Sentinel. This is for you, Mr. Mayor, and also for you, Alvina. All these numbers seem to be trending in the right direction with the exception of deaths. So what's our concern now? What's our worry?
Well, I still worry about additional individuals who will contract the disease and ultimately get sick or who will die of it. I'm concerned about that in our community. I'm concerned about that within the employ of Orange County. And so we still have to be vigilant in that regard. The good news is that it does not appear that there's any other variant on the horizon that will cause us any concern. So I am very optimistic about this upcoming holiday season and what that means for us. Hopefully, as Americans, we will see more of a season that we're customarily, we've experienced over time. So I just look forward to that, where we can act more normal. We can gather, we can spend time with our families. So if we continue to get vaccinated, continue to do all of those things that's been recommended, that will be the season that we will experience. Ms. Hsu, I don't know if you have any comments.
I think you brought this up. So your comment about the deaths increasing. So the deaths are a lagging indicator, meaning that the trends of it follows at least a month or a little bit longer, partly because of reporting and also partly because of biology, people who get ill and potentially ill for long periods of time. And so we do expect that the deaths will trend downwards as it will follow with the cases. As far as where we are and our concerns, I think I've always stated that I'm concerned. I'm the microbiologist, and so keeping an eye on viruses. And so currently there are no other variants of concern besides the Delta strain, which is the predominant strain now on the CDC's monitoring list. There are some variants being monitored. And so I think vigilance is important. And, the key basic things that prevent infectious diseases that we promote as pandemic precautions are the same key preventive measures for all infectious diseases. So hopefully people will mind those moving forward now that we've all had this experience. You know, covering your cough, washing your hands frequently, especially after toileting or sneezing and coughing, and watching your distance in general, and especially staying at home if you're sick and away from others who might be potentially vulnerable as far as the immune systems.
Lauren Seabrook, Channel 9. Alvina, my question's for you. When you look at how fast the cases have really dropped off and the positivity rate, and then you look at, the last time we were down, I think we got down to about 3% positivity rate. How far do you guys expect us to go? Do you think we could get to a point where it's almost gone, or do you think we'll stay between 3 and 5% long term?
That's a prediction that I don't have enough information to make, but the COVID will likely be with us in the world for a while. So we've built up some great immunity here. So as the mayor had mentioned, the immunization or the community immunity here is good, very good at 74%, and we continue to try to increase that immunity. Also, the natural immunity that has occurred from all of the cases helps improve the community immunity here in our situation. So the upcoming holidays, we are optimistic, will not, hopefully not see a surge like we did previously in the summer. Will we ever? I don't know. I don't want to speculate on a personal level or on an official level about whether or not we'll be free of COVID anytime soon.
Dave McDaniel, Channel 2, with a question rather for the mayor. So I don't want to throw water on anybody's campfire. I think we're all elated that the numbers are going in the right direction. But I think there's still, as you go around town, you're seeing fewer and fewer people following some of the guidelines that have been stressed throughout this. And I know we all want to have a normal holiday season, but what is the message for people to maybe not burn the mask in the backyard and go running about, since we still are in what was considered a substantial transmission mode?
The message to our residents is still that you have some personal responsibility to ensure that you do what you can do to protect yourself and your families, but also to protect others. I think that's where we are. And so even though, yes, a greater number of people are not wearing facial coverings now, I believe some of that is related to the fact that we have 74% of the people who are now vaccinated. And sometimes I believe they feel that if they're vaccinated, then they have a lower risk, and perhaps they do have a lower risk, but there's still a risk of exposure there. And so I just ask our community to continue to be responsible and make appropriate decisions as they move around our community.
This is Melissa Thomas with Florida National News. So my question is for you, Mayor Demings. Obviously, recently you had the event that was kind of tied in with AARP to kind of help the quality of life for seniors, but did you hear any feedback from them as it relates to where the county is with the COVID-19 kind of requirements or mandates? Are there any more pain points that you've heard from them that are different from what you've heard before?
I try to move around amongst the seniors, and I do that really on a regular basis. And our seniors have a higher rate of vaccination amongst that group of individuals, and they also are much more vulnerable. So I continue to see if anyone wears the facial coverings and really takes heed of all of the recommendations regarding social distancing, et cetera, it truly is the seniors that are in our community. And so I think that, that's a positive overall for our community. And again, we still all want to make certain that when we're around our seniors that we exercise appropriate protocols when we interact with them, because they truly are more vulnerable. Okay. All right. It appears that Scott Howard from the schools got off easy today. Let me just say thank you all for joining us. The next press briefing is scheduled for next Thursday, the 21st, at 4:30 p.m. So be safe, be well.
Alabama.